Okay, Assalamualaikum warahmatullahi wabarakatuh. For this activity 2, we decided on address the issue of placebo sleep. But first, let me introduce myself. My name is Norashkin binti Zakaria, and my group members are Masrifah Diana binti Rosli, Nur Azlin binti Sani, Siti Hajar binti Muhammad Hanafia, and our group leader is Muhammad Akmal bin Ayub. With this, I pass these sessions to our leader for further discussion.
Okay, thank you. Assalamualaikum. So this is our second activity. Okay, firstly, we go for the topic that we all have agreed, which is placebo sleep and effect. Secondly, we go for attention getter. Placebo sleep is an interesting new piece of research reinforce the fact that our minds are amazing things. It turned out that if you think you got a good night's sleep, your mind act like you did. On the other hand, the placebo effect is your body healing itself or relieving pain because you have been told you were given medicine. Even if the pill you took was only sugar, placebos are used in pharmacological research to test whether or not a new drug is more effective than just the belief that a substance is effective. The question is, can placebo replace sleeping pills for patients who's suffering insomnia and depression?
Okay. Hi, Assalamualaikum. My name is Nur Azlin Nisani. I continue. We want to inform our audience that proper sleep is known to contribute to feeding better and functioning better. But thinking you got a good night's rest could might make that. According to a recent study, people who get placebo sleep believing they had better sleep than can benefit from enhanced cognitive function. Nombor 4 siapa?
Placebo sleep is a new knowledge and new in research. Usually, we often heard about microsleep.
Okay. A placebo is substance or therapy that has no effective ingredient and is given in order to assess the effectiveness of a medicine or therapy or to provide benefit to a patient who believes the treatment will be helpful. The human mind is such that belief in the effectiveness of a treatment may be all that is necessary for it to produce a positive effect regardless of its true psychological impact on the body. This is known as the placebo effect.
Well, that is interesting. Based on the article that I read, placebo conditions are used in psychological research to control for the effect of the non-specific aspect of the treatment. For example, in study investigate that the effectiveness of a new psychological treatment for insomnia, it would be necessary to eliminate factors that are not believed to contribute to a beneficial effect but could foster improvements such as attention from the research. Being involved in an interesting project, having hope that the treatment will work on and so on.
Okay, I get it. This placebo effect is the same as mind controls, which is we control our mind and our mind will control our emotion. For example, if we go through some pain, we set our mind that it is not hurt. Then our body will respond as our mind directs. Is that right?
Yes, exactly. There are some cases when viral in the past few years, as I remember, the gynecologists use this technique to calm mothers who want to give birth.
Apart from that, there are this one viral case on issue related to mental illness become hot topic when an eye surgeon, Professor Dr. Mahaya, has answered the issue of anxiety disorder, telling patients to stop taking medicine and fight with our own emotions. However, the issue aroused anger amongst psychiatrists and mental illness experts. And in my opinion, as we know that psychological conditions such as emotional support and concern can create optimal conditions, can be conducive to suffering and illness. Furthermore, sleep goes beyond getting simple rest for everybody. And the brain and body are currently active performing important tasks that help promote both mental and physical health. But that doesn't mean everything can be fight with placebo. In some cases, such as mental illness patients, they really need to depend on medicine, while some normal cases can use this placebo in order to reduce dependency on drugs.
I agree on that statement. I think that the placebo effect could be really helpful to get a better sleep. Moreover, many people nowadays who have a busy life that are leading to anxiety, better than they taking sleeping pills, since sleeping pills is controlled medicine in our country and drug is not good for human body.
Okay, now we have all getting into concern of this topic. I think it's all for this discussion on this activity. Thank you for the participating for all of you. I should end this session. Thank you.
Thank you.
Thank you.